If you've done physical therapy, had x-rays or an MRI, maybe even injections or medications, and your back pain is still there, hey, this episode's for you. Because one of two things is true. Either you're broken beyond repair or something important was missed. And I'm here to tell you right now, it's not the first one. Today, I'm going to walk you through 5 very real reasons your back pain isn't going away, even though you've done everything right. And more importantly, why this does not mean you're out of options. I hear it all the time. Doc, I've tried everything. And when people say everything, what they usually mean is physical therapy, chiropractic, stretching, rest, ice, medication, injections, spinal decompression, and laser. And then a whole lot of frustration sets in. Most of them were told one of 3 things. Your imaging looks fine. This is just part of getting older, or my personal favorite, you'll just have to learn to live with it. Let me be very clear. Ongoing pain does not mean ongoing damage, and it does not mean nothing can be done. It usually means the wrong system was evaluated and treated. Let's talk about the first reason. Reason number 1. You don't have a weak back, even though you've probably been told, hey, your core muscles are weak. You have an inhibited one. Most chronic back pain is not caused by weakness. It's caused by muscles that have essentially gone offline. So your brain decides, I don't trust this area because it hasn't been receiving information from it. So it stops fully activating the muscles that are supposed to protect you. Trying to strengthen a muscle that won't properly turn on, well, it's like pressing the gas pedal while the parking brake is on. You're not weak. You're disconnected. Reason number 2. The nervous system was never evaluated, more importantly, never treated. See, pain is produced by the nervous system, not by your MRI, not by your x-ray. If your care never evaluated how your nervous system controls movement, balance, or stability, then the root cause was never touched. That's why people sometimes can be told, hey, everything looks normal, and still live pain every day. Reason number 3. Passive care can only take you so far. Don't get me wrong, passive care feels great. You get adjustments, massage, hot packs, muscle stimulation. They calm things down. But calming pain is not the same as fixing the reason pain keeps coming back or has never left. If care never transitions into active rehabilitation, your body moves and stabilizes in the wrong way. Pain relief becomes maybe only temporary. Relief without active rehab equals relapse. Reason number 4, imaging ruled out danger, not dysfunction. This is a big one. MRIs are excellent at finding fractures, tumors, and serious pathology. They do not show muscle timing problems, coordination issues, movement inefficiencies, or nervous system inhibition. So when someone tells you, hey, your MRI is normal, that just means structurally or mechanically. But that doesn't mean nothing is wrong. It means nothing is life-threatening was found. And those are 2 very different things. Reason number 5, compensation was never corrected. Your body is incredibly smart, but if one area isn't doing its job, another area will pick up the slack. That works for a while until it doesn't. Chronic back pain often isn't coming from the painful spot. It's coming from what stopped working before the pain ever showed up, hit the muscles. Here's the most important thing I want you to take away from this episode. If your back pain hasn't gone away, it doesn't mean care failed. It doesn't mean you have failed. It means the right type of care was never provided. Most people stop and they lose hope. Very few ever get movement and control restoration. That's where things can actually change. So in upcoming episodes, I'm going to break down why physical therapy, chiropractic care, and other forms often fail chronic pain patients, and things that doctors say that actually delay recovery, and how to know when a second opinion can change everything. So if you're still hurting and you feel stuck, make sure you subscribe and tell others, because not all has been done, and this channel exists to prove that.